Went over to Dana's house and we sat down and I was like, okay, so Dana's going on medication now. I'm so sick of this shit.
Yeah. Yeah.
I've been dealing with this forever.
Literally.
This is so annoying. Look what's happened here now.
Oh my God. Dude, stop it. I have a story for you. Can I be mean for a sec?
Wait, I forgot to tell you.
Shut your face.
What the shit?
I cannot.
Can I vent for a second?
Welcome back to Gimme the Goss. I'm Dana Barron.
And I'm Katie Valley, and we got a lot to gossip about today.
We have a special guest today. You still have food in here.
No.
We have a special guest today, guys. Our third special guest on the pod.
Hello.
Katie's just going to try to get the food out of her teeth. Would you like to introduce yourself?
Hello, I'm Dr. P, Dr. Elizabeth Palumbo, clinical psychologist, sister-in-law of Dana, friend of Katie.
Yay. Welcome.
Thank you, guys. It's so great
excited.
to be here. I love it here already. I love the space. I love you guys.
Yeah, this was exciting. I'm happy to have you here. I do think we need a little bit more background, though, because you're not like just my sister-in-law.
What am I else?
You were one of my best friends since we were 14.
Yes,
And then you hooked up with my brother.
behind the couch in the basement. Well, we actually did sex a few years before we started dating.
And then you started dating when officially?
It was like the summer before senior year because I was hooking up with a lot of people, I think. I think.
Just add a hint to the
It
list.
was either junior year summer or senior year summer where I was hooking up with a lot of people. But yeah, so then we finally were settling down with Mikey P and finally told Dana.
No, but you told me after you were hooking up before you started dating.
Did we?
You told me in Molly's bedroom.
Well, because Molly and I had secret society.
Yeah.
And that's where we boned, but we didn't tell you. People.
Boned different people.
Yeah, not each other.
Yeah, it sounded like each other at 1st
Mhm.
So you boned different.
We could talk about scissoring. It's one of my favorite topics as well. And I'm sure it's also the middle-aged suburban mom's favorite topic.
I'm sure it is.
Yeah.
Lizzy.
Okay,
I'm
so
sure
that's
it
just
is.
me?
Yeah.
Okay.
Jesus Christ. Secret
Sorry.
society.
So that's where you would bang other people, or you would hook up
Well,
with
like
other
I
people.
banged her brother and she banged this other guy.
No,
Okay.
I didn't.
Molly.
Bang anyone.
No, Molly
Molly.
did. Yeah, Molly
Yeah.
did.
Oh, was this
This
was
a
the
secret
North
society.
Carolina trip. My dad was mad at me for being antisocial because I was reading Crime and Punishment in my room the whole week because I brought 2 friends on vacation. Mike brought 2 friends on vacation. But Lizzie and Mike were hooking up and Molly was hooking up with the other one. And I had a boyfriend and the other guy had a girlfriend and we were not attracted to each other at all. And it was just like me and him. And so everyone, my dad was like, "You're being so antisocial." And I wanted to be like, "Well, Molly is hooking up in the shower downstairs, Dad. You want me to go hang out with them?" But I couldn't tell them because my dad would be like, "Wait, Molly's hooking up with somebody." So,
And then I asked your dad once if I could sleep like in Mike's bed
and
when I was sleeping over, and he was like, because he was really cool. We like smoked butts together, chilled.
Wow.
Looking
Did
back
he
on that,
say
I guess
yes
that's a
to
little
that?
weird. He was like, no.
Okay.
Yeah, it's a one thing. He was
Yeah.
like, nar.
yeah, he was like entertained by Lizzie, but also like didn't know what to do with her.
Yeah.
Yeah.
And was still trying to be a father
Yeah.
figure. 'Cause I didn't
Right.
have one because I hate mine.
Okay.
Are we editing that out or keeping
can
it?
edit
Let's
it.
keep it for the people.
Okay.
Okay, let's
Okay.
get to the goss.
That wasn't the goss.
What?
Oh, the goss is coming up now.
Yeah, that was like
That was
historical.
pre-goss.
That was historical.
Yeah, that's just giving a little background
Historical
to your
nonfiction.
relationship.
cool.
All right. So, Lizzie, quit being weird for a second and
All right,
tell
we're gonna
us,
be serious.
tell the people, tell our listeners, what type of psychology do you practice? Who do you help? Start with that.
So I have my doctorate in cognitive behavioral therapy. So I do CBT, and I also do some DBT, dialectical behavior therapy, and also ACT, acceptance and commitment therapy also.
Okay.
And so the population of people I help, I used to work with the criminal population. I did forensic psych,
Wow.
but now I switched
Yeah,
to general
you used
population.
To be, like, you used to be
Badass.
expert witness, right?
Mm-hmm.
Yeah, that's so cool.
That
You're like
is
on
so
I'm cool.
SVU.
I'm amazing.
Yeah.
I know. So I used to be forensic psych, and then I switched to general before I had a child spawn.
Yeah.
Mhm.
And then got a job at a private group practice, and I help people Currently, like, age 15 to who's my oldest person? Like, 75.
Oh,
Wow.
wow.
Yeah,
How do you decide? I don't know the differences between all those therapies, and then how do you decide which approach you take?
totally. Well, the main one is cognitive behavioral
Yeah,
therapy, which
I've heard
encompasses
that
a
one.
lot of, like, interventions, but ACT is, like, a lot like, incorporating your values and what's important to you and just, like, accepting that we're gonna have, like, shitty emotions and things happening to us, and we're gonna have a roller coaster, and we're just committing to using our skills to get through
Okay.
based on, like, what's most important to us
Is
and
there
living
like
in the space of our values, and that helps people a lot.
is there like a gold standard of like talk therapy at this point?
They say CBT is very evidence-based, ACT. DBT is for,
Oh, that one.
that's for, like, borderline personality disorder historically and, like, very suicidal patients, but it's skills-based, and there's, like, you learn, like, interpersonal effectiveness, mindfulness,
Okay. Do you
communication
ever
skills,
combine the
relationship
therapies? Like
skills.
with what?
Yes, I
Okay.
try to be I stick mostly to CBT, but I am a little eclectic when I add these other evidence-based treatments, interventions, and stuff in.
Okay. I've heard about the other one too. What's the like eye movement one?
Oh, EMDR.
Yeah.
Yes, that is a lucrative practice right there. That's
Yeah.
for trauma,
Okay.
patients
Yeah.
mostly, and it's this really cool thing where basically bilateral stimulation of your brain helps to process trauma memories
That's so
properly. That kind of therapy is talk therapy, but it also involves, like, a ringing or a sound on each side
I
of
got
your
a buzzer
head.
in both of my
Yeah,
hands when I did it.
Oh, you
exactly.
did
Oh,
it?
great. Yeah, you get a buzzer or something
Yeah, I
or
only did it once. It was very cute. I was trying to process the trauma of foster hiding for me that day.
Okay, yeah.
But turns out I really just had generalized anxiety and panic disorder that needed to be medicated.
Mhm.
So EMDR
not
was
just
not.
from that
It's
day.
not
It
the
was not that.
Mhm.
It wasn't
Okay.
that one incident. It was
Yeah.
my brain not having enough serotonin in it, which we can talk about a little bit today if we want, because
Yeah.
Lizzy definitely walked me through that
Yeah.
traumatic
And we've talked
event.
about it. We've
Mhm.
hinted at it on the pod so far,
Should
but
I
we
just talk about it?
yeah, why
Yeah,
don't you
let's
go
do
into
it.
it? Yeah.
Definitely.
Well, Lizzy, how would
'Cause
you?
you're, like, the population of some of the patients that I see,
Yeah.
right? So
Yeah.
Yeah.
makes a lot of sense.
Well, Lizzy, you know me for a long time. Why don't you explain what was happening to me and what you saw in my history?
So, I think what happened for Dana was that there was already, like, obviously, anxiety is genetic, so no one's fault, no one's mother's fault, God's fault, really. The first
His fault.
humans, it's
Capital
his
H.
fault with an H, capital, and then it came, genes come down through generations, right? And so I think Dana already was predisposed to probably having some anxiety, and then, her dad died, so that's trauma, but she already had anxiety.
Mhm.
Could we talk about turning around to
Yeah.
go to the bathroom, leaving the house, but then immediately having to turn around to go to the
Oh.
bathroom
Is
So
that an
for
anxiety thing?
well, I
yes.
also
Okay,
have
Shitting your
IBS.
pants?
Yeah.
Mhm.
Shitting your
Yeah,
pants. Oh, we're
that
talking about
is
shitting. I thought about the pee thing because
oh, a
you're a
pee is
big
a nervous pee, and that's
y
from being in
you
fight or
do a
flight.
I
lot of
do a
nervous
nervous
pees.
pee every time
I didn't
before we
realize that
start the
was
podcast.
really
Yeah.
connected with anxiety, but yeah,
Yeah.
okay.
Yeah, because
So
when you're in
So,
fight or flight, those muscles relax, and you
yeah.
might pee because
um,
And
blood flow goes
IBS
to the
is
bigger muscles in
very
your body.
connected
Oh,
to
yeah.
yeah,
so
to
you're
anxiety.
big on like whole body as well, right? Like you don't really see a huge like when I got really sick, it's like the mental health is physical health,
Yeah.
and physical health is mental health. Like
Yeah,
there's
1,000%. 1,000%, like
So anyway, Lizzy used to drive all the time in high school. She had a purple Dodge Stratus that
Oh.
beeped when it backed
in
up.
reverse.
Oh,
So she used to drive all the time
okay.
because part of her anxiety is like being in control of a driving
Okay.
car.
Anyone who has anxiety tries to control things or avoid things.
Yeah.
I know
Yeah.
I've seen
Classic.
that in a lot
Uh-huh.
of my friends.
Yeah.
Don't name
So
names.
Lizzy used to
We're not
drive us
naming
in high
names.
school all the time. So
Yeah.
she would always come pick me up, and then we'd get to Four Corners, and I'd be like, turn around, I have to poop.
Oh
And I'm like,
my
"Oh
god.
my god."
Yeah, okay.
I still had mild anxiety at that time. My full, like, panic disorder hadn't come out yet,
Yeah.
'cause that came out in early 20s, which is a lot of times what happens with people. But I
Yeah.
think
Yeah, I
Dana had
heard, like
panic
I thought it was, like,
disorder.
18. Like, I thought 18's kind of not the magic number, but, like, that's where it starts to
Yeah.
hit, like,
Probably,
as
like
you're
yeah.
entering adulthood.
Yeah. 1,000%. So I think she had panic disorder and, like, trauma stuff, just undiagnosed,
Uh-huh.
untreated,
For
for
20
decades.
years, 25 years.
Mhm. And then finally it came to a head, and she went through a terrible period of constant panic
Mhm.
and anxiety, and it was so debilitating that she couldn't even get out of bed,
But it
like,
was, like,
leave the
manifesting
house.
as physical, right? Like, was it
1,000%
yeah.
Yeah, I
anxiety is
was
the most
nauseous.
physiological
6
nausea.
months of being nauseous, like, it started at, like, those holidays where I really started getting nauseous, and
Mhm.
then I got pneumonia that spring.
Oh my gosh, that was when we turned 40, and also turning 40, that's a really big deal psychologically, I think, for any person, especially women,
Okay,
Yeah.
interesting.
right? Like,
Yeah.
the big 40,
Yeah, of
Yeah.
course.
over the hill,
Yeah.
into the
Mhm.
black zone
Yeah.
of
Out to
death, everything
Yeah.
is
pasture.
worse. Yeah. Yeah.
Plus, also, I mean, not that you would necessarily be feeling them, but some people, like perimenopause too, like
Oh
all those
my
hormones
gosh.
fluctuating.
And you never know
Guys
when that's starting.
guys, we
Everyone's
also
Mhm.
like,
lived through a fucking pandemic.
Yes.
"That's
Yeah.
right, I always
We're
forget that
into the
one."
full decade of Trump presidency,
Yeah.
global
1,000%.
instability, civil war, famine. Not that it's here, but it's like social media, like all these things just
Yeah, yeah.
exacerbated. And then when I got pneumonia and couldn't breathe, that's kind of when I started the panic that would go away.
1,000%,
So I was
yeah.
nauseous. I couldn't
Mhm.
eat. And then the worst part was I would go to bed at night and my whole body would start convulsing and I couldn't make it like shaking like the worst fever you've ever had in your life,
Mhm.
but just every night when I laid down to go to sleep. And that's when Joel was like, "What the fuck is happening to
Yeah.
you?" And I was like, "I'm dying. I have cancer. I need to get one of those Gwyneth Paltrow scans of my whole body that
Pronovo.
costs 3,500.
Yeah.
What is it called?"
I think it's called Pronovo.
Yeah.
Mhm.
Mm.
And then I was like, "But I can't go in the tube. They'll have to drug me
No,
to even go in
exactly,
the
yeah,
tube."
mhm. And it
Um,
was all crumbling down.
all crumbling down
Dread.
so
Dread
hard.
And
City.
up to this point, we should say that some people in your life recognize, well, I'm sure Lizzy, but like
Everyone in
everyone
my life.
recognized that there was anxiety happening and recommending medication. But
Mhm.
you were really, it was like, I'm not exercising enough. I'm not eating the right things. I'm
Mhm,
I
drinking too
mhm.
drank,
much.
I didn't sleep last night, and then it was like the pneumonia really, like, brought me to a place I couldn't come back from, and then both of my boys got rushed to the ER. I rushed both of my boys to the ER back to back without Joel around. Remember I had to
Yeah,
drop
drop
Brody off that
boats off.
morning?
It was very high, tense
Yeah, and
Mhm.
I just couldn't come out of it,
times.
and I was just so physically ill and just
But it was almost like you needed to get to that point
Yeah.
to realize.
Yeah,
Yeah.
because there's layers and layers of, like, some denial or some
Mhm.
It felt like I
conditioned
was failing
things.
to
Right,
go on
yes.
medication.
And anyone also who has anxiety doesn't never wants to go on the medication because 'cause you're
Yeah.
scared to go
Right,
on the
because you're scared to go on
medication.
the medication.
Yeah.
I
But
was
it's so
afraid that it would,
helpful.
like I'd lose my edge, that I would be numb, that I wouldn't be a good mom. Like, there's
Mhm.
also things like you have no sex drive anymore, like, you
Mhm.
can't orgasm, like, there's so many different things you hear
Yeah.
about that you're like
Right, yes, some of the
Scared.
potential
Right.
side
Yeah.
effects.
Yeah.
But now,
Now she's boning
yeah.
again, and she's very sexual now, Kathy.
I was gonna say now you're the spokesperson for a sexy
Uh-huh.
Lexi, but
Yeah.
Yeah, dude,
yeah.
if you're even contemplating it, just go on the
Yeah.
meds. Do
Yeah, so
not
then we
raw
were like
dog this
Dana.
life.
I went over to Dana's house, and we sat down, and I was like, "Okay, so Dana's going on medication now. I'm so sick of this shit.
Yeah. Yeah.
I've been
Well,
dealing
'cause
with this forever.
I
This is
Literally.
so
You've
annoying.
been
Look what's happened here now."
I mean, you even talked about as a child, like
Literally.
thunderstorm. I don't know. You were saying
Always
something
scared
about
of the dark,
yeah,
which is common, but it's
to
these things
another
stay
level.
with you, and then it builds and builds and builds, right? If it's
Mhm.
not kind of, like,
I was so I was
managed.
just scared of everything. I've just
Mhm.
been scared my whole life of everything. And yeah, I drove to meet you in Paterson
Oh,
at
that's right.
Montville Diner.
Yeah. Pine Brook,
And,
mon
like, I was just so used to driving, having panic attacks, but I was just, like, so at the end. Like, I didn't even know if I could make it, and I got there, and I parked the car, and I was shaking, and I was hysterically crying, and I was, like, hyperventilating, and I was like, "I can't get out of the car." So I called them, and I was like, "Guys, come to the parking lot. I can't get out of the car." And they were like, "Oh, what's wrong with you?" Like, "Ah, she's so annoying, ah." And then they get to the parking lot, and they were like, "Oh, okay." And I know it's really bad when Lizzie's,
Dana
like,
need
very
helpy.
gentle and,
Yes.
like, very sweet and, like, goes into, like, doctor mode,
Yeah.
and I was like, "Yeah, this is not great." And then we drove home. Oh, and the talk about, like, psychic mediums and stuff. So, I was afraid I couldn't drive home. I
Yeah.
was afraid I'd have another panic attack and be alone on the highway or whatever. So Lizzie's like, "I'm gonna drive, you're gonna follow me, and we're gonna stay on the phone, we're gonna have the windows open." And remember we were driving and you were like, "God, I just wish Larry P," who was my dad, "I just wish we could go, like, go talk to your dad, and he would smoke a butt, and he would calm us down, and he would, like, help you in this moment. Don't you wish she was here? And then the white butterfly flew right by
Oh.
her window and then right by my window, and Sylvia Rossi had told me back in the day
Oh, that's
that my dad
right.
sends me butterflies. And we were like,
Oh.
"Ah!" And we were like, "Ah!" So yeah, then we went home and we made an appointment with I had Julie the next
Yep.
day.
You talk to your therapist.
Talked to my therapist. She gave
Scheduled
me
with a prescriber.
Yeah.
Mhm.
Med City, baby.
Ed City.
And that's
I
where we
never
like
looked back, really.
Never looked back.
And
We'll
don't
never
look back.
Yeah.
Yeah, don't
Like
look
I
back.
never
Once
like I
you
was
feel like-
so
yeah.
pissed once it kicked in
Mhm.
and once I felt like back to homeostasis, better homeostasis. I was like, has everybody else just been fucking rolling around feeling like this?
Mhm.
You sleep,
Mhm.
you eat,
Yeah.
you don't imagine
You
your whole
smile.
family going off a cliff in a car every time you're on the highway. You don't imagine the plane going down every time you're taking off. Like, you
Yeah.
don't imagine every worst outcome constantly before you go to bed at night.
No.
Wait,
Yeah.
you guys are all doing that? I thought we just did that.
Yeah.
Yeah, so if you're feeling that way, please consider seeing a medical provider.
I think we're seeing too, like a lot of women our age, and maybe you can talk to this, Lizzy. Like, I mean, we had a girls' night, and a lot of the women are.
We were like, oh, what are you on?
Yeah.
Like, oh, Zoloft, Prozac, Lexapro. Because,
Yeah,
like,
yeah.
of course,
Yeah.
we're
No
in
shame.
this world,
We're in this crazy world.
this society
Yeah.
that fucking hates women.
Mhm.
We have no structural support or safety net. And we're raising kids through this while dealing with our own shit. Like
Yeah.
even talking about like body image and stuff with women, it's like the asylum where they
And
raised us.
Well, yeah.
Ooh, gosh.
Insane.
What's that? Just that we have to be skinny and
Just like
Yeah.
parents taking you at 10 years old to Weight Watchers,
Oh,
Tyra
I know.
Banks,
Oh my gosh.
America's
So you
Next
started
Top
watching
Model,
the-
like
that documentary I have
fat
to watch.
shaming of
No, but I
every
want to watch it
celebrity.
because that used to be one of my favorite shows. I love
So
shows
did
like
I.
that.
So I made her watch it. She was like,
I was
don't
at
think
UMass
I can
senior
watch
It was
year.
actually really triggering for me.
Really?
Like,
Well, we never knew also that you had as major of like
yeah, I hid that.
eating.
But we all did. It was
Until
so
we were
normalized in
older,
high school.
yeah.
Like you didn't really have it as much as like me, Molly, Marina, Shri. Like we all were always dieting and stuff in high school and being praised for it.
Yeah.
Like as soon as I lost like a little bit of weight in high school, everyone was like, "You look amazing." So
Yeah.
it's like, "Oh, okay, noted." I looked like shit
Mhm.
before, even though I was a totally healthy, normal weight and just in my normal
with
body.
a gorgeous body, which everyone has a gorgeous body.
Yeah, so it's like even just that, like
I mean,
living
we grew up in the era of fat-free. Like, everything was
Yeah.
fat-free. Everything was reduced fat.
Kate
like,
Moss.
Yes.
Like
Oh my God, wait,
nothing
yeah, I
tastes
used
as
to
good
drink
as Skinny
Slim
Fat.
Fast.
Yes.
Sweet
Yeah.
chocolate ones actually kind of tasted a little good.
Yeah.
Should I get those again?
But you also love like airplane food and
I'll eat out of the trash. I'm a go
Wow.
greatest of all time, and I'll
Airplane
eat.
food?
Yeah,
Loves it.
Okay.
I'll eat a tin can.
Wow.
Hmm. Yeah.
but I feel like your body image was never as sensitive as mine.
I probably
Like you had a sturdy
I always
body
had
image.
issues. I always thought I had like fat legs. I would never wear shorts and fat arms, and I would never wear
Oh.
tank tops.
But you always thought you were dead sexy.
But I did have narcissism, right? Because we get things from our parents. That was a dad comment, not a mom one, because I know we're not talking about moms.
Yeah.
Yeah.
Well, you can
Um,
talk about your mom.
yeah.
I just
We
wanted
just
to
don't
let you
wanna-
know
Yeah.
that we
Yeah.
decided not to talk about our moms on this podcast at all.
Oh,
Just out of
like
respect.
ever for any episode, it's just your guys' rules.
It's just our rules.
Yeah, I
but
love
you can
that,
do
because
whatever you
that's,
want.
like,
But you can talk about your mom.
that's good boundaries.
I feel like Canine's good.
Canine's a gem. Yeah, she always supported me and never fat shamed or anything like that.
Yeah.
I mean, we went to the YMCA and did like some jazzercise classes.
Billy Blanks.
Yeah. Oh,
Billy Blanks
Blank.
was what we did in college.
Mhm.
Same.
Yeah, so much Tybo in college.
So much.
And then, yeah, we'd always go to the DC, the dining commons. We'd go like work out, do our Billy Blanks,
Yeah.
go eat like a bowl of cereal,
yeah.
Mhm.
and then go out.
Yeah.
Mhm.
Mm-hmm.
Drink your face off.
Mm-hmm.
All
Yeah,
right.
I think for me, it was like never a conversation in my house. Like, weight was just never a conversation. So I just never thought about it. It
Mhm.
never, I mean, it surrounded me for sure,
Yeah.
but it just wasn't in my household. And I remember some of my friends, their household, like my one friend, her house, like, her parents would hide food, like, any
From
kind.
her?
Yeah.
Yeah, that's really common.
No.
And I think that was very common, just, like, no food in the house, no snacks. Like, if there was a cake, the cake was gone in the morning. Like, if there was a
Mm.
celebration the night before, it was
Wow.
gone in the morning. And a lot of my friends would come to my house because we had salami and cheese
Yeah,
sandwiches,
you
and we had
did.
white bread, guys.
Oh, I didn't realize that was, like, a nostalgic
Oh, that's very
food for you.
nostalgic.
Oh,
Yeah.
wow.
Katie's a vegetarian who eats charcuterie
Yeah.
and
And the
salami
salami cheese
sandwiches
sandwich.
and
Salami
But
and
I don't
cheese
eat it
is
a
are you
lot,
Italian?
buffalo
guys.
chicken
No. Oh,
pizza.
my dad's side is Italian, but I
Yeah.
just love it on white bread and where it's,
I
like,
can't with the
so
white bread, though.
gluey.
Dana does this thick white bread. I'm like, "How do you even chomp that shit
Oh,
down?"
I
It's like the
love
hot
white
dog
bread.
eating
She's
contest where all
so
the bread's like,
offended.
it's like
You didn't grow up with white bread then?
probably did, but
Yeah,
it
you
wasn't
didn't,
as
didn't.
thick
She can't
as
stand the thickness of the bread in my
Yeah.
Yeah, like,
house.
we probably had, like, the Wonder Bread.
When we go on
Yeah, that's what we
vacation
had.
and
What?
do shopping trips, she's like, "I need you to get, like, normal bread because the Barons love a thick loaf."
We can't with the thick loaf because then I don't know, that's like my 90s, I'm just like, that thick loafy carbs becomes my hips and
Yeah, well,
ass.
that's
I
the
don't want that
thing.
white carb
Mhm.
in my upper tricep arm.
You don't even know it's ingrained in your brain, and
Right.
it definitely is in there,
1,000%.
like,
A friend of
100%.
mine who's microdosing GLP was saying that the best thing for her, which she didn't even realize, was it quiets all the food noise. And
Mhm.
Oh,
she's like,
yeah.
I didn't even realize
Yeah.
how much brain space that was taking
Yeah.
up every day. Constant
Yeah,
thinking
you
about
don't.
food. Yeah.
I know, I hate the food noise,
Yeah.
but I'm scared to take a GLP. I might take the pill now, but no, I'm too scared because I have anxiety, I don't wanna take the pills.
Yeah.
Oh, there are pills? GLP?
Wegovy just came out with a pill.
What?
Who
Mhm.
did?
Wegovy.
Yeah, that's the one that Serena Williams is pushing, isn't it? Roe?
They have injectables, but,
No, they have pills now
and the
too.
pill, yep,
Yeah. God, my
yes.
entire feed is like that's another thing. It's like social media. It's like I get ads about like keeping my independence as long as possible. Like, how old does Instagram think I am?
Yeah.
And then it's all like, your face is a fugly leather bag.
Yeah.
Here's some injectables. And like, you're disgusting. Like, here, take some pills. And like, it's crazy.
Yeah, it's
Like,
constant.
how can you not be thinking about
Leather
it?
bag
Yeah.
is Sean Penn's face, though. You don't have
That
that.
is Sean
Yeah,
Penn's
no,
You
I don't
have
think
that
I
yet.
have it, but
No.
Instagram does.
Yeah, and that's what the women our age are talking about in therapy.
Yeah, let's get back
They're
to-
having issues with still, if they're from the 90s, like self-esteem,
Uh-huh.
want to know how to have better relationships with their partners and their kids,
Mhm.
and, like, just to deal with anxiety, so much anxiety.
Is anxiety more common than depression, or is it like split C's?
I'd say for my caseload, just anecdotally,
Mhm.
it's probably a little bit more anxiety with the moms that I see. There's also depression and, like, ADHD, bipolar, like
So my
Yeah.
nurse practitioner who prescribes me my Lexapro said that anxiety and depression are basically cousins on the same spectrum, just
Yeah.
different ends. So she's like, if you struggle with anxiety at this level, because basically when I saw her, she was like, out of a 1 to 10, you're probably at like an 8 right now.
Mhm.
10 is like, what were you saying when you see things?
Hallucinations,
Hallucinations. I wasn't having
delusions.
those. Um,
Oh, does that come along with anxiety? Hallucinations?
oh yeah, panic attacks can have. That's
Oh,
what the woman
what?
on
That's
Oh,
very
the
severe.
Big Little Feelings was saying she was walking because she was this woman on Big Little Feelings. I don't know if you follow them on
No.
Instagram. She was about like 2 or 3 months ahead of me on her like anxiety,
Journey.
overwhelm
Mhm.
journey. And she was saying that she was walking down the street and people's faces were like turning into demons.
Oh, wow.
Yeah. And I was like, okay, that
Okay.
hasn't happened to me, but
Yeah, no,
that's
that's
like
very escalated. Sounds more severe.
yeah.
For sure.
So, but she's
didn't
like,
know
we
that was a
want you to
thing.
be living at like a 2. Because like
Yeah.
you have probably constantly just existed at like a 3 or 4.
Right.
But she was saying that when you have anxiety for this prolonged at this level, you have definitely or will definitely in the future have a depression episode to balance it out, basically. Which now, in hindsight, I definitely look back and see depressive episodes in my life that I just didn't identify as such at the time.
Yeah.
Mhm.
Like I remember St. Patrick's Day Hoboken back in the day?
I was just thinking about that because St. Patrick's Day is coming up.
Yeah.
Mhm.
And there's all these parades and
Yeah.
stuff. And I'm like, oh my gosh, remember when we went to Hoboken wearing green, got fucking blackout,
Yeah.
and just don't know what we did.
Uh-huh.
Yeah.
I think I was there at the same time as you
Oh,
guys.
definitely. We
And
must have
you'd always go
overlapped.
into a K-hole the next day
Mhm.
after drinking.
Yeah.
Oh,
So much
really?
anxiety.
My friend from college and I, we used to call it PADS because we would both have it on Mondays and Tuesdays, and it was
Okay.
post-alcohol depression syndrome.
Mhm.
And I still get it today. Like, if I drink too much one night, like, I have a couple of days of feeling really sad and anxious. Never the levels before because I think the
Yeah.
spread doesn't allow
Yeah.
that, but it's definitely there.
I think that's normal, right? Like, after
Yeah.
drinking
Well, you
to
can probably
Well,
explain it.
drinking's like a depressant for sure. Like,
Okay.
slows down the central nervous system, and then people have freakouts about it. So they're like, "Shit, I'm an alkie. What's wrong with me?"
Mhm.
Yeah.
That kind of stuff. You get anxiety then from it.
Well, my
But
point
it's, like,
in
delayed because in the moment when you're drinking, you're feeling great,
And it's
and
the
then
drop.
Oh,
it's
yeah,
the drop
so
after.
delayed, 1,000%.
And I think a lot of drugs do that, right? As well.
That's why it's literally called a K-hole.
Yeah,
Mhm.
because you go up and then you come down.
Oh, okay.
Well,
I've
the
never
only
heard of
reason
the
I
K.
brought up St. Patrick's Day,
Okay, sorry.
Hoboken, was because I
I think
remember
that's like ketamine or something,
Yeah.
Okay.
Yeah.
which is now a treatment for depression. It's a
Yes,
nasal
I've heard
spray
about this.
treatment for depression,
Which
for severe
also
depression.
is that what the one Elon Musk loves?
I know nothing about that
Okay.
decrepitise, so
Mhm.
maybe, but
Anyway, I remember one year of being like, I don't want to go. All my friends were partying, and I was just like, I'm sad. I don't feel like going out. I'm just going to stay home. And I stayed home in bed and read the entire
Twilight
Twilight
series?
series
Oh, man, I do remember
Whoa,
in a
that.
Dana.
weekend.
Oh, God.
Wow.
Yeah, and I'm like, oh, yeah, I think I've had some depressive episodes in the past. And that was like mid-20s because it was before I met Joel.
Yeah.
So it's like mid-20s.
Yeah, absolutely.
So yeah, in hindsight,
In hindsight, yeah,
definitely have
was
struggled with
there.
depression. Then, of
Mhm.
course, postpartum and all that. Like, those were definitely big
Triggers.
depressive episodes that I didn't realize as such. So,
Yeah.
anyway, I just wanted to clear that up because a lot of people are like, no, I have anxiety, or no, I have depression. But it's like, if you have one, you likely have had the other, right?
1,000,000%,
Yeah.
because it's just, again, like, the cells in your brain are sucking the serotonin and, like, the good, happy chemicals back up into their little cell house,
Mhm.
and the juices aren't there to just, like, flow around and play in the ocean,
Mm-hmm.
Yeah.
and it get
That's why it's a
the med keeps it out there flowing
selective
around.
serotonin reuptake inhibitor.
Inhibits the reuptake.
So it stops the serotonin from being sucked up into the cells, so you have more
Can
serotonin.
play in the ocean.
That's why
Yeah.
the nurse practitioner was like, you're basically taking, like, an SSRI is basically like taking a serotonin supplement because you're allowing your brain
Exactly.
to have more serotonin, which is the leveling of your moods and the anxiety.
And depression is like a lack of that, so if you're supplementing that back in, then you have less depression, less anxiety.
Mhm.
Okay, so SSRI is used both for anxiety and depression then?
Yes.
Oh,
Mhm.
okay, I don't think I realized that.
Yep, and OCD, high levels treat OCD.
Okay.
Yeah. And when these mental health symptoms, come into play and we're married and we have kids, it affects like sex life,
Yeah.
social life, all these things. So like a lot of times the women I talk to, if they've just had a kid, there's usually always a discrepancy between like sex drive in the relationship. Like one person wants it more often and one is less.
Uh-huh.
I have one couple right now, or one woman, because I don't see couples. I'm afraid of couples. But
Fair.
she wants it more than her male spouse. But that's
Wow.
more rare.
Yeah.
Because I have a few more situations where the women are like, my guy's trying to bang me. I'm 4 months postpartum.
Yeah.
I feel a duty to do it, but my body is decrepitise.
Uh-huh.
I have a prolapse. It's
Can you define
painful. This is-
decrepitise for the listeners who don't share your vocabulary?
Okay, absolutely. Decrepitise is like, has anyone seen Zoolander? Like derelict, like
Mhm.
that's the dark, like
Mhm.
bad, like
Yeah.
trashy,
Yeah.
gross, disgusting,
Yeah.
scum of the earth, scum between my toes. Like you're damaged and something's fucking wrong with you.
Right.
You're decrepit.
Okay, wow.
You're decrepit.
Wow.
Ease.
Yeah. Okay.
So you just put an
But
ease
that's
on
how
the end.
women feel about their bodies. You're not
Yeah.
saying that they're decrepitise.
No, I
Right.
would never say that. Women are gorgeous, have
Yeah.
gorgeous, gorgeous bodies, but they feel that way.
Yeah.
And sometimes their spouses put the pressure on because they feel left out, they're not getting attention.
Mhm.
A lot of men that I'm seeing are saying that they do see sex as a connection, and they're not getting
Yeah.
it, and they get really insecure,
Yes.
So I'm
and they
actually
don't know how to handle it.
I actually just started
Mhm.
reading for like the second time in 20 years, Mating in Captivity by Esther Perel.
Haven't read it, but have heard it's like a pivotal
Yeah, and
writing.
that's
Yeah.
literally the chapter I'm in right now is that, like, because so many men in our generation were not raised to vocalize their emotions and their need for connection, and then the
Mhm.
way that they feel, that they do it through gestures or, like, acts of service or their
Mhm.
bodies through sexual connection.
Mhm.
So when they're being rejected, they're not seeing it as sexual, they're seeing it as a rejection of
Mhm.
them as a partner
Mhm.
in their relationship. And I haven't gotten to the end of the chapter yet, but Esther Perel was saying that, like, just because women are socialized from an earlier age more so than men, as a generalization in our generation, to vocalize as a way to form intimacy and connection, it doesn't make one or the other better.
Right.
So
Mhm.
you can't just demand that he give intimacy through conversation and then totally reject his form of
Yes, there
Mhm.
intimacy.
has to be a
Yeah.
balance.
So I was like, "Ugh."
1,000%
Bye.
you were. Yeah.
I'm just kidding. It's a really good book, and we're gonna talk about it on our sex
Yeah.
podcast at
That's
some
so
point. We'll get there,
exciting.
guys. We'll get there.
That is
I
so
originally thought
exciting.
maybe Lizzie would come on, but then I was like, I don't really wanna hear about sex with my brother, so we're
Yeah.
not gonna have
Fair.
Yeah.
Elizabeth
Fair.
on
Mhm.
for the sex episode.
Are you finding that in the relationships, or obviously you're not seeing couples, but the people that are in the relationships, is that top of the list? Is it sex?
It's okay,
Like, for our
interesting.
peer group.
Yeah.
I'd say mostly the women I'm seeing that are married and have kids that are, like, our age are coming in, yes, for I'd say anxiety.
Okay. Yeah.
And then we talk about how
Everything
their
that comes around that.
relationship or the pressure to have
Mhm.
sex or this, that, like, feeds the
Mhm.
anxiety or the dissatisfaction in the marriage.
Yeah.
Because also right after you have kids, they say is the biggest time of, like, marital dissatisfaction, which no one
Mhm.
really ever tells you. And so it's like a lot of people think it's a fairy tale to get married and have a baby, and then
Mhm.
you do it and
And
you're in
it's
a
a
nightmare,
nightmare.
and it fucks up your whole world.
Yeah.
And I read, like,
And relationship, it
the
changes.
divorce rate under 5 years old or up until 5 years old is so high because it's such a hard time. You're learning each other again as
Mhm.
parents, like, it's a brand new person that you're learning.
Yeah,
Mhm.
you're not
You're
sleeping.
not sleeping. Also, like, fair play that we were talking about, like, there is
The mental load
this
is
mental load that comes along with motherhood, and it's just intense. It's an intense period.
Exactly. So it's really hard. So the moms coming in are struggling
Mhm.
with, yeah, pressures to be intimate, anxiety, like work stuff.
And I'm curious, like, what that, ratio is of men versus women. Do you find that? Because I just find, just from talking to people, men typically are a little more resistant to therapy.
Yes, I used to think that, but
Okay,
all the men now are coming out of the
great.
woodwork, which I honestly think is great.
Yeah, I'd love
Um,
to hear that. I mean, I
and
think therapy in general is being normalized, right, just in society.
1,000%. Like if you're Gen Z and you don't have a therapist, you're not cool.
Yes,
So
yeah,
you have to like, but that's amazing that people are open to it and like, because again, our mental health is our health.
yeah.
Mhm.
And if you don't have your sanity, like you have nothing.
Yeah.
My niece is 21, and I feel like her generation is just everyone is in therapy.
Yes.
And a lot of them are medicated, and I think there's part of it being normalized, but also the pressure that these teenagers/young adults are feeling just in school, in college, and just keeping up with everything, with their grades, with sports. It's just so intense
I
that
have a lot
everyone
of teens too,
do
and
you? Yeah.
I have someone I'm working with right now is terrible eating issues and self-esteem because she has so much pressure to get perfect grades. She lives in like an affluent town. The mom puts the pressure on constant. And so this girl tries to control everything with food.
Yeah.
As we know, that's like a classic one, but
Mhm.
that's still happening. So
And do you
teens
find
feel so much pressure.
and, like, the social media thing, is that just wild for you to, like, see the pressure of that on young kids?
For some reason, that doesn't come up too
Oh,
much.
great. I love to hear that.
Yeah, there's
Okay.
never when I used to work in the
But they're all on
forensic.
it?
Yeah. So, I used to see, like, 11 and up, so those younger kids weren't really on it, but
Okay.
now mostly just 15 and up, they have TikTok,
Mhm.
Instagram, what's that one, they send
Oh, Snapchat.
Snapchat,
Mhm.
yeah,
Oh, that's
that
still a
kinda
thing?
thing. Yeah,
Yeah.
yeah, and there's all different ways to communicate, like, if you snap someone with, like, half a face, it's like you have a crush or something. I don't know, there are these weird rules
What?
now,
Okay.
but there hasn't been too many social media, like, backlash issues since I since I worked with sex offenders. Like, the general
Okay.
population, it's been less of an issue.
Oh, really?
Anecdotally for me. I'm
Okay.
But
sure
do you
other
think that
people.
Yeah, yeah.
But do you think that, I mean, we have so much research now in Jonathan Haidt's book about the anxious generation and the impacts of social media, specifically video games on adolescent boys and Instagram and TikTok on adolescent girls. Like, there is an undercurrent, right? Are you saying that, like, anecdotally, the people you're seeing just haven't had major issues on it, but do you think it contributes?
I would have to say if the research is pointing to that, I'm always a little spurious about some research, but there's got to be some sort of impact.
Yeah.
I
Mhm.
always just want to think it's not as bad
As
as
it
it's being made out to be because I think our just media is very hyperbolic and
Mhm.
wants a click and wants this and that.
Mm.
Um, so again, for me, just with my caseload,
Mhm.
since I switched to the general population, it's been less issues where social media or comparing or things like that have influenced someone's mental health, like, very, very poorly.
Got it.
Mhm.
So maybe those parents are doing a good
Yeah.
job now that we have the information
Right.
and
That's
this,
my
that.
hope, right?
I
Is that,
really hope
like,
so too.
the
Yeah.
generation above us, like older Gen X raising their kids, like, they didn't have the data. They were navigating it,
Mhm.
or even, the child psychologist that we see in our family, like, she was saying that our generation of parents, like, she has young adult children, and she's like, "I didn't really have to navigate this." Like,
Mhm.
YouTube wasn't really a thing when my kids were 4 years old,
Yeah.
right? So she's just saying that, like, our generation is the first that really has to figure out how to navigate this now that we have the data and now that it's, like, so omnipresent in our lives.
Yeah,
Yeah,
just
maybe.
trying to oh gosh, I don't even know, just trying to limit what your kids are on, always trying to
Yeah.
watch it, but kids and teens, they're just always gonna find a way.
Yeah, dude.
So, like, stop even trying, do
Stressful.
We
your
found a
best.
way.
Yeah,
Yeah.
exactly. Just
100%.
try to be as a good enough parent, and, like, you just have to, like, let
Yeah.
Jesus take the wheel sometimes,
Yes, let
right?
him take the wheel.
Him with an H capital. Yeah,
Yeah.
you have to do your best just raising a good human to make good decisions
Mhm.
and based on their values and what's important in your family,
Mhm.
and then making social media and internet and phone decisions off what's important to your family and
Mhm.
helping your kid. Just open
Yeah.
communication, talk about everything, tell your parent, talk to your kid about it, like, you know?
People find a good therapist. I get that question a lot because I'm like,
Yeah.
well, I think ours is at max capacity.
Mhm. She definitely is.
And I never know if I can send people to you because I don't know if it's like conflict of interest, depending on, not conflict of interest, but like someone in your personal life you
You
might not want to
totally
see.
could send to me available daytime availabilities currently.
Oh, okay,
Mm.
great.
Yeah, my nights are really slammed. Um, and I'm pretty packed right now. A
Yeah, I
lot
was
of
gonna
peeps
say
are in therapy,
nights.
so
Yeah.
Wow.
yeah. But, yeah, so you can send anyone to me and they can just do just a brief chat. I do, like, a quick phone call with everyone to see if
Mhm.
they think it's gonna be a good fit, if I
Right.
think it's within my scope
Well,
to
how do you
do.
advise people on finding a good fit?
So,
It
I
is
think
hard, right? Like,
there's
I've
Yes.
so
only
many
ever
factors.
ridden your coattails into therapy. Like, every
I
therapist
know.
Elizabeth's had, I get that
Yeah.
So I've never had to look for one,
Yeah.
and because we're similar, like, it was always just a good fit,
Yeah.
but how do people find, like, what are some questions to ask to figure out if this
Understand.
person will
Yeah.
be a good fit?
I think, like, financial and stuff is always a
Mm,
Yeah.
factor. So, if you have insurance, I'd probably start, like, on your insurance website.
Mhm.
If you need a therapist, just someone local to you, or even now, like, I know with virtual, you can see a psychologist that lives in, like, South Jersey if you're in North Jersey. So just going on the website and it really is a crapshoot. Probably have
Yeah,
yeah.
to.
you know what I've done too? Like, on Facebook, we have, like, Montclair Moms, Dads, and Parents. We have, like, a local group of just
Yes.
I'll just search out therapist in that group just to see who people are recommending, and then by there, I kinda look to see, are they taking my insurance? Are
Mhm.
they So I feel like a local recommendation is sometimes good as well,
Yeah.
or just Google, like you said, like, if
Just
you can look under your
Googling.
insurance and then see the reviews. You know me, I love a little
Yeah, I
research.
I
hate
know, I
research.
hate reviews, though. I'm like, "Who is
Yeah.
saying this?
Yeah,
Who
fair,
did
fair,
this? Who
fair.
said this?" Like,
Yeah.
I don't know if this is
I
valid.
just like to see for everyone, like, all my doctors I go to, I just like to see, like, what people are if it's, like, 5
Oh,
reviews, I
everyone
usually
does
move it.
it. Something's
Yeah.
wrong with me, not you.
Yeah.
Yeah.
You normal, me weird, you know? Exactly. So, yeah, just trying to go through your insurance website, word of mouth, like,
Mhm.
Has there
most
ever been, like, a patient or a consultation where you're like, I can't, this isn't the right fit"?
yeah, and there's been one main one that I was like, "This person should not have been seen by me because they
Mm.
tried to ruin my life."
Oh, really?
But I
Okay.
prevailed.
Okay.
I win, girl. Yeah,
Wow, okay.
but,
That sounds a little
absolutely, yes,
intense.
so absolutely there's times when it's not a good fit,
Yeah,
and you have to be like, um
like, out of your scope kind of
exactly,
thing.
like, it's
Yeah.
like if someone comes to me for couples, I'm like, "No, I'm
Yeah.
sorry," and then I try to refer to someone that I know who does couples.
And then do you work wait, are you a do you prescribe medication?
Nope, I do
No.
not
So
prescribe.
then do you
That's
work
a
with someone who
psychiatrist or a
a
nurse
Mhm.
practitioner.
psychiatrist, yeah, I mean. So you work hand in hand to
Yes,
yeah,
there's different practitioners around the area
yeah,
that I can refer to, and also looking for a psychiatric nurse
I
practitioner
love the
on
mhm.
nurse practitioner
again, through
versus
insurance
yeah.
or
And you've recommended
psychiatrist.
her to some of our
Oh, yeah, a
friends.
handful of people have gone to
Yeah.
her, because she's just very I think you were the one who mentioned that, like, sometimes a nurse practitioner might have better, like, bedside manner and
Mhm.
sort of compassion in the conversations, and I found that with her. I was really in crisis,
Yeah.
and I didn't feel like she was rushed, I just felt like she was, like, with me, I felt, like, very well taken care of.
Yeah.
Yeah.
So I'm always a big fan of the nurse practitioner, honestly.
Yeah. Yeah, that's
So,
really nice.
You're basically a doctor
Yeah,
as a nurse
exactly.
practitioner,
yeah.
so
And it's nice to I mean, for me, like, I always try to find female because I
Mhm.
just feel, like, more comfortable, I feel like they can relate a little bit better. You said she was,
mhm.
like a loving
Just
aunt.
yeah, she just felt, like, invested, and she
Mhm.
still does all a couple years later, and
Mhm.
everyone that I've sent to her has also said the same thing, that they
Yeah,
just
and
love
also, well,
her.
let's hope because it is,
Yeah.
like, a big deal, right? Like, you have to
Yes.
be
Yeah.
confident and
Yeah.
caring, and so it's really hard sometimes to find a good fit, but
Well, I
keep
just
asking around,
I
Yeah.
just know
and you'll
people who have
find
been like,
something.
"Oh, I just asked my GP for,
Yeah. Mhm.
Mhm.
Xanax or whatever," and it's like, your GP is not an expert in psychiatric meds
Yeah, no.
and the ongoing maintenance of psychiatric meds, which I
Yeah.
think is
Exactly.
extremely important because not everybody's like me where you just go on the first thing that they prescribe to you and it works and feels
Right.
great and you move on. Like, sometimes it doesn't work and you have to try a
Switch it
few
up.
things or different doses, and sometimes people have more side effects. So you need someone, I think, like
A professional. You need someone who's a specialist
yeah.
in that field because I think there's so much
And there's so
that they
like
need to navigate through.
yeah, just because one thing doesn't work doesn't mean the next thing
Right.
won't. So people get discouraged, they feel like it's not for them, or they don't take it properly. Like, I just feel like psychiatric
Mhm.
meds are something you want someone who's really invested in and expert in to manage that. Because your GP, how often do you see your GP?
Yeah, never. Guys, I never.
Exactly.
Literally for my physical once a year, and that's it. Otherwise, I'm in urgent care,
Me
Yeah.
too.
and that's it.
Mhm.
So I just kind of feel like they're useless.
Somehow I had the trifecta on the day, like, that I got all like, I got myself sorted out. I had seen my GP that morning, my therapist that afternoon, and then
The stars were aligning.
Damn, girl.
The universe
the
was like,
universe
"It's
was like,
time."
"Oh, this fucking chick. Can
Yeah.
we just get her on some meds
Yeah.
already?"
Yes.
But, I mean, I honestly have seen you
But
talk about to other friends, and it's so good because I feel like when you're in it, you can't see it sometimes.
mhm.
And, like, I have never, thankfully, really struggled with anxiety, but after Ollie was born, I was a hot mess. I was in Sydney by myself,
Ollie was
and
colicky.
Ollie was colicky and literally had
Oh
no help.
god.
And I just remember being like, "This feeling that I'm having, I don't know what to do with it." Like,
Yeah.
I couldn't, like, get out of it, and I remember just going to the doctors and saying, "Give me Xanax."
Mhm.
And, of course, it was such a small dose, and they were, like, concerned to just give me medication. And I'm like, "I just need to get through these next couple months."
Yeah.
And it did nothing for me. I'm like, "I'd rather drink wine than
Right.
take the
Well, because
Xanax."
that's Xanax is not for ongoing
Right,
anxiety maintenance,
right.
right?
Yeah, oh my gosh, sometimes I see people that have been taking Xanax every day for, like, 3 years,
Wow.
and I'm just like, no judgment, of course, if they need it, because sometimes there's cases that do need that, but I'm
Mhm,
just like, what a struggle then to get off.
Mhm.
mhm.
If you need to or to wean down, like, because the
And there's a
benzos
better fit
really
out there.
absolutely, for daily anxiety and
Yeah,
depression maintenance and emotion management, absolutely better fit, something
yeah.
you can take every day versus, like, a benzodiazepine like Xanax,
Where it's just kind of
Or
Klonopin,
yeah,
that you also have to
Valium.
withdraw from and come
Yeah.
off of,
right.
like
It's just like a spot treatment, which is super helpful, especially for panic
right,
attacks and when we can't talk ourselves down or we're not able to use other coping skills.
right.
Yeah.
Yeah, I still have the, I forget what it's called now. the prescription Benadryl for panic attacks or
Oh,
for
yeah.
flying and stuff, which I've never had to take since the Lexapro kicked in, but, I just liked that better, and that's what I mean, the psychiatric nurse practitioner was like, "You don't like how you feel on Xanax,
Yeah.
but you are in a prolonged like, we have to get you through the next week,"
Yeah.
basically, because
Right.
Joel was like, "Okay, I get the Lexapro long term, but, like, how do we
Cope.
deal with this now because
Mhm.
she can't get out of bed?" And, and the Xanax didn't feel right to me. It kind of made me feel like, I don't know, it just didn't hit me right. And she was like, "Oh, basically prescription Benadryl." And it was
Yeah.
Mhm.
amazing,
Yeah.
So like the GP, like even my GP that day was like, if you have an appointment with a psychiatric nurse practitioner, like go to her.
Yeah.
Like she's who you need right now, not me. She's like, I prescribed you Xanax. Like she prescribed me like 2 Xanax
Oh
pills
my
to like
gosh.
fly once. And
Ah.
she's like, but that's not what I'm here for, and I'm not gonna be able to manage it appropriately.
Yeah.
So she's like, go to her.
Well, I think that's really good advice for
Yeah.
people, you know?
Oh my god, everybody.
Yeah.
Everybody
Everybody.
get on the meds, there's no
And I
shame.
will link to the psychiatric nurse practitioner
Yeah.
in these pod notes because she's wonderful if you're listening in New Jersey, and she can probably refer you to someone in your state if you're not. I don't know what the bylaws are for, I'm assuming a nurse practitioner has a license in each state.
Yeah.
Yeah,
Um,
just the state that you're licensed in, I think.
Yeah.
yeah, so you can just book an intro consult call with her
Mhm.
if you're feeling anxious right now or you're one of our friends
Yeah.
who we've been chatting about
Mhm.
this. Go see him. And we'll link
Ooh, which friends?
to we'll link to get in touch with Lizzy too if you'd like to reach out for a therapy consult or a referral. But I know you need to jump in 1 minute, Lizzy. Is there anything you'd like to leave the Gimme the Goss audience with today?
This was so much fun. Hopefully, I can come back and give more goss on different stuff.
Yeah, we
This
love
is
that.
like I was nervous at first, but this is so comfortable.
Oh,
You guys
yay.
are so chill. I love this.
Okay, guys. So that was Lizzy, who you've heard about on this pod before.
That was so much fun.
Yeah. Yeah, she's my favorite nut job since we were 14. We had when we everybody got their schedules the first day of freshman year of high
Mhm.
school, Lizzy and I were the only people in our grade. Our
Mm.
lockers were right next to each other because it was Nicola and Palumbo,
Yeah.
and every single class of the entire year
Together?
together.
What?
The only 2 people.
Yeah,
It
that's
was
like unit
the universe wanted us to be best friends.
and now
And
sisters.
then she stole my brother. Oh, JK, it's the best.
Yeah.
Yeah, so we wanted to have Lizzy on to talk about the goss from the therapist chair.
Mhm.
Because honestly, mental health is a lot of what we chat about. We
A
had a
lot.
group mom hang. When was that? Last Friday?
Friday.
Whew, it was like a round table of mental health and what meds everybody was on.
Yeah.
And
And it's a real thing, and I think especially, going into perimenopause or maybe menopause for some women, the hormones plus just this world, right?
Mhm.
Just today, just waking up to the news today alone.
So
Okay.
it's also not just our generation.
Yeah.
Because I see a very lovely older female gynecologist in
Okay.
Montclair who I'm obsessed with. Well, she's like, it's been a while. What's been going on? I'm like, well, I had a mental breakdown since I saw you
Mhm.
last. And she's like, yeah, I see you're on Lexapro now. I'm like, yeah. I'm like, and I think I might be having some like peri symptoms and stuff. And I was like, but I've heard sometimes a gynecologist will prescribe an SSRI as you're going into peri or as you're
Mhm.
like really starting to see menopause symptoms because it helps with all of that.
Yeah.
So sometimes that's the first intervention before doing like hormone replacement and stuff. So I was like, so I'm good, like going in. She's like,
Yeah.
yeah. And I was like, yeah, it just feels like all of my peers like struggle with anxiety and stuff. She's like, all of my peers did too. We just used
Oh,
to give them Valium.
yeah,
She's
that's
like, and
so
everybody was
crazy.
fine.
Yeah.
And I was like, cool, mommy's little helper. So like, I also just think
Yeah.
we've normalized it and we're just more open about
And we're
it.
talking about it,
But like, if you
whereas
are a woman living in our society,
Mhm.
how do you not
Yeah. How do
have
you not?
some level of anxiety?
Yeah.
It's like if you're awake and
Yes.
you're not
100%.
intentionally upholding the patriarchy.
I literally was just on social yesterday. I just had to just put my phone down.
Yeah.
I just can't anymore. It's just too much. And then I saw you today, like, oh, I'm just looking at countries that
Oh, yeah.
will
Well,
accept.
it's like Instagram's always sending me, like, here's how you can escape to a remote island in Ireland. I'm like, I don't really think my hair would do well there. It's cold.
Priority is.
But there was so much goss to talk about today, too, which we
Oh,
don't have time to get into.
okay.
But
Did you have something you wanted to talk
Well,
about?
it's just, Timothy Chalamet, I don't know how
Oh,
to say
yeah.
his name,
Oh,
opera
the
and
opera
ballet.
ballet thing?
Yeah, shout out, to another Lizzy who sent it to me. I was like, "You need to talk about this on the pod, but we're not gonna have time."
Yeah.
Christine Nome and her
But we
husband.
can talk about it maybe next week, like,
Yeah,
Christy Nome,
and her
yes.
husband and Corey
Yeah.
Lewandowski. Britney Spears got arrested, Shia LaBeouf
Wait,
got
Britney Spears
arrested.
got
Yeah,
arrested?
she got
What
a
happened?
DUI. Shia
Yeah.
LaBeouf.
Dude, what is wrong with that
I
guy?
think he has mental health issues.
Yeah, I think
I
so
think
too.
that's what's going on. Oh, and the
When he
last
was saying the guy touched his leg?
yeah.
Uh-huh, okay, sorry.
And, yeah, so there's a lot of goss in the world to talk about today, and I keep meaning to tell you this, so I'm gonna
Oh,
sneak this one in,
okay.
and I don't know if we've talked about this before, but you know the store next to Holston's on Broad Street? The,
No.
like, really weird looking, like, I think it's called, like,
Oh, it's like
Barney's
a pharmacy?
Bargain Barney's or something?
Okay, no, I've never been in there.
You will love it.
What?
It is like a mom and pop Marshall's.
Really?
Hot finds in there, Katie.
Next to
Hot deals.
Holstein's?
Barney's Bargain, and then the wine and liquor place.
Okay, no, never saw it. I mean, maybe I have seen it, I just never
You
paid
gotta get in there.
attention. Okay, did you buy clothes from there?
No, but I canvassed
Okay.
for, like, immigrant protection of all the small businesses,
Wow,
and
when did you do that?
I don't know,
Some point, yeah.
some point.
Yeah. And you saw it?
So I went in there,
Yeah.
and the woman who owns it is so sweet. I had
Wow.
a great conversation with her, and, like, hot deals, like, good
Really?
clothes, hot deals, amazing find, little treasures,
Okay.
clothing,
I'm gonna
accessories,
take Tiff
shoes.
there because Tiff loves
Yeah, it might be hit or
little
miss, but
thrift
the 2
shop.
times I've been in there, I've been like, oh, this is cute. Oh my god, look at these shoes." Like, it's you would
Is
not
it
expect it.
thrift?
No,
Oh,
it's
okay.
literally bargain.
Wow, okay,
And I was
great.
like, "How can Katie not know that this little
I know.
treasure
I
trove
love
is
a sale. I
here?"
love a sale.
Anyway, I think that's all we have time for today,
Yeah,
right?
I think that's it.
It's 11:07. We did
Okay,
it.
we did it.
So we'll have lots of podcasts about the
To
world at
catch up on,
large to
yeah.
catch up on next week, but we really just wanted to treat you with Lizzy, and,
God, she's great.
isn't she?
Yeah, she really is.
It's funny how she goes in and out of doctor mode.
Yes, I've never seen that side
Yeah,
of her, and I
yeah,
was really here for it.
yeah.
And then just following up with stories of hooking up with your brother,
Yeah,
you know?
Secret Society, I
Secret
hated them.
society.
Molly, if you're listening, I'll get you too. But anyway, guys,
Okay.
all right, that's what we got for you. Until next week, love you, bye.
Love you, bye. Thank you for being here, friend.
If you like the show, please leave us a review wherever you listen to your pods and go ahead and subscribe while you're at it.
And then be sure to follow us on Instagram, TikTok, and Substack at Gimme the Goss.
Okay, love you, bye.
Love you, bye.